Dr. Mark Kissinger, Medical Director for the Jefferson County General Health District, Dr. Ken Woods, Infectious Disease Medical Director at Trinity Health System, and Dr. Charles Kakaiko, Superintendent of the Jefferson County Educational Service Center. The Jefferson County General Health District wanted to provide this brief community update as we navigate this wave of COVID-19. The reality is that COVID-19 will be here for quite some time, so it is vital to manage your risk factors, practice good hygiene, stay home when you're sick, and of course, highly consider vaccination if you have not done so. Not only will these strategies keep you safe, but they will also decrease the strain on our healthcare system. Furthermore, a healthy community should in turn keep the local economy healthy as well. Given the high rate of community spread, the CDC recommends masks in indoor public settings to reduce the transmission of COVID-19. Notice I use the word reduce because it would be naive to believe that masks totally eliminate the spread. Masks have particular circumstances in which they can be effective, such as healthcare, congregate living, schools, public transportation, and in crowded indoor environments. You may ask, why not a mask mandate? The state legislature passed a law in June prohibiting mandates or blanket health orders by state and local health agencies. So while masks are not necessarily warranted in all situations, it is your choice more often than not to add that extra layer of protection. And I would be remiss if I failed to mention that not all masks provide the same level of protection. As for isolation and quarantine, positive cases and close contacts should continue to follow the most up-to-date CDC guidelines. In order for the health department to recommend isolation for a positive individual, we must have proof of a medical diagnosis. A positive lab report is this proof. Local testing sites have been very good about getting us this information in a timely fashion. If you use a self-take-home test, you must forward the positive result to info@jchealth.com. With that in mind, you should not take any shortcuts with home tests, as this could lead to an invalid result with no report. COVID-19 boosters will soon be available. As for the exact date, we are unsure at this time. But what do we know today? Pfizer and Moderna will be the first vaccine manufacturers to have boosters approved. Johnson & Johnson is expected in the near future. However, their rollout was roughly 70 days behind others, so their data is still being analyzed. We have a booster interest survey link on our website. Please go to jchealth.com to access the survey. If you receive the Johnson & Johnson vaccine, you should wait until more information is available to complete this survey. We will communicate accordingly. For the vaccinated not interested in a booster right now, please know that 2 doses of the Pfizer or the Mrna vaccine or 1 Johnson & Johnson dose will still allow you to be considered fully vaccinated. This is subject to change as time goes on. It is important to know that the entire state of Ohio is seeing this same wave of COVID-19 cases. All states in Ohio remain in the red according to the CDC. Jefferson County has 681 positive cases over the last 2 weeks. These are numbers that we have not seen since last winter. Public health agencies have a duty to prevent, promote, and protect its population, but we also believe in human rights and ethical decision-making. Yes, we will continue to promote the COVID-19 vaccines and mitigation strategies because they work and the science supports it. Our ask of you is to understand your local health department's role in striving for the optimal health and well-being of Jefferson County. Finally, for those interested in the COVID-19 vaccine, our nursing department offers vaccines on Tuesday morning and Wednesday afternoon by appointment. We have an outreach clinic this Friday from 10 a.m. to 2 p.m. at the Eastern Gateway Community College parking lot. This is open to the public and the vaccine will be Pfizer. Also, be sure to check with your local pharmacy for vaccine availability there as well. Thank you, and I will now turn it over to Dr. Mark Kissinger.
Good evening, and thank you. There are 2 main areas I would like to briefly discuss tonight. First, I'd like to discuss the immunizations for COVID-19, and second, the testing, which is available locally. I have 2 main objectives in discussing the immunization. The first is the safety of the immunization, and the second is the efficacy or the effectiveness. So starting with the safety, there have been around 179 million Americans vaccinated and many other people around the world. There have been some serious concerns, and I'll try to go through them and talk about them as best I can. First, with the Johnson & Johnson vaccine, there were approximately 40 women under the age of 50 who had a clotting disorder which was related to the vaccine, or at least thought to be. They went back and dove through the data. It ended up being around 7 women out of every million vaccinated actually had a problem with clotting, and the FDA, upon reviewing the data, realized that the risk of clotting by not being vaccinated and having COVID was significantly higher. So they have once again recommended it. If a woman has concerns about clotting or a risk factor with clotting, they can pursue one of the other vaccines. In regards to the other vaccines, the mRNA vaccines, we've got Moderna and Pfizer. There was initially a concern about possible myocarditis, which is inflammation of the wall of the heart. That was seen in men between the ages of 20 and 34. The risk of myocarditis without the vaccine and catching COVID is around 18 times higher than normal, and the risk with the vaccine is 3 times higher than normal, so clearly the vaccine has a benefit. So I do believe in transparency. That's why I'm giving you these details. I don't want to scare anyone off, but I think we should have an honest, an open conversation about it. So just summarizing the data, the CDC recently came out with a statement last week, and basically if you're not vaccinated and you contract COVID, you're 4.5 times more likely to get COVID than those who are immunized. You're 10 times more likely to end up in the hospital, and you're 11 times more likely to die than someone who's immunized. So those are pretty significant reasons for going through the vaccination. I know this is an overused statement. Ben Franklin was quoted as saying, "An ounce of prevention is worth a pound of cure." What that means is that we can do something small like getting the COVID-19 vaccine and reduce our odds for having a big problem like quarantine, hospitalization, and worse. Next, I'd like to discuss testing available for COVID-19. PCR testing is the gold testing. We've had that locally available for quite some time, thankfully. Generally, the results of those tests take anywhere from 3 to 12 hours. They're very accurate. Lately, we've had availability of testing of the rapid antigen testing, which Mr. Henry spoke about, which has been available through the library, through some of the public schools, as well as through the health department. These tests are able to get us a result in as short as 15 minutes. We're able to make a quick decision. So if you've got concerns, if you think you may be sick, my best advice is call your physician. They can come up with the best method for you to get tested if needed. Next, I would like to just briefly discuss some benefits of the newly utilized technology in making these mRNA vaccines. You know, this technology can be used to treat other diseases. They project that most of the vaccines in the near future will be developed using the same technology. We can use it to treat diseases like malaria or prevent diseases like malaria, which kills millions around the world. It's already being researched in the treatment of sickle cell anemia as well as multiple cancers. So it's terrible that we've lost many lives. However, there's a silver lining. And on a final note, I'd be remiss not to mention what are the things we can do to improve our odds that don't involve vaccinations and medications. First, in general, the healthier you are when you have a problem, the more likely you are to survive that problem. So exercise, healthy diet, healthy body weight, well-controlled blood pressure, and good exercise are all vitally important for the health of ourselves as well as our community. And these are things I think we can all get behind and support. These are inexpensive ways in which we can absolutely improve our mental and physical health. Thank you for your time and attention. I'll turn it over to Dr. Woods now.
Thank you, Dr. Kissinger. I'm an infectious disease physician with Trinity Health System. I just want to talk to you briefly about what we're seeing on the hospital sector. The community was very lucky, in the early summer, June, July, we had pretty low cases locally. Come the tail end of August, in the past month or so, and first half of September, we've seen an explosion of cases. It's really put our health system, struggling again like we were back in the winter. So every day, it's a new crisis. It's a new situation that we're dealing with, whether it's limited access to, staff and employees because of quarantines with COVID or illness themselves. It's been very challenging. We're now running faces against medication shortages. There's national shortages, which, you see on the news with a lot of the bigger cities that got hit first. We're now falling into that to where we have access issues getting medications that were once fairly routine locally and used certainly to treat COVID-19 illness to where we're running out of options. And so it really circles back down into, the community as a whole, as, Andrew and Dr. Kissinger mentioned, the importance of vaccination is more important now than ever. When we look at the people that are hospitalized that are vaccinated versus those that are not vaccinated, they're night and day difference. They're shorter length of stays. They're off of oxygen much quicker. and overall have a very quick turnaround if you're vaccinated. The people that are unvaccinated, they're almost identical, risk factors, whether it's comorbidities with obesity, diabetes. The folks that are not vaccinated have a much more higher acuity of illness. They're very sick. They're oftentimes on breathing machines. They spend weeks in the hospital before we can get them stabilized enough to even go to the next step like rehab or home with oxygen therapy. It's night and day difference when you see it every day. When our numbers are going up, that's one way to keep our community safe, to keep you guys safe. And I certainly encourage you to reach out to see. Most pharmacies are able to give the vaccine now, and access is not really an issue today like it once was. That I also want to mention is testing. As Dr. Kissinger mentioned, if you feel unwell and think you need a COVID test, the first step should always be to call your doctor. Call your primary care doctor. If you don't have one, there's a lot of places that offer same-day appointments, urgent care clinics, walk-in clinics. It's always best if you think you have a respiratory illness such as flu or COVID, is to call the center first in case they have triage protocols or quarantine situations to where you're not in a waiting room with other patients so that you can be triaged accordingly. We have various sites that Trinity operates throughout the region that can see a provider same day like that and have access to testing when and if appropriate. If you do have an order for a test, whether it's a pre-op test or your primary care doctor has evaluated you, a telemedicine visit or whatever, but you have an order for a test, we did reopen the drive-through testing site at the Trinity East campus. It's on limited hours. It should be posted on the Trinity website now, so you can go there and access that. But that's a very quick drive-through, nonstop sort of testing where you don't have to have a reevaluation, but it does require a physician or APP order to get access there. If you need evaluation by a provider, that limits you back to the express care, urgent care centers. And if your situation is severe enough and your symptoms are severe enough, then the emergency department. But of course, the emergency department is not the only place to get access to these testings. We have various other sites, depending on your level of acuity. If you're struggling to breathe, you have a home pulse ox and it's in the 80s or less. You're gasping for air. You have a loved one that's in distress or confused or so weak they're having trouble ambulating. That's something that obviously should be sent to the emergency department for a more formal evaluation. So with that in summary, I just want to conclude with just reminding everybody to try to get access to vaccine, mask when you're in an indoor setting around congregated patients, with a close proximity. And now I'll turn it over to Dr. Kukaiko to provide you more.
Thank you, Dr. Woods. Area schools are tasked with the responsibility of providing a safe learning environment for all of our children. This is an obligation that we do not take lightly. The pandemic has certainly been a disruption to the education process and changed how schools have functioned. Last year, some decisions were made at the state level, and districts operated within those regulations. Since then, Ohio has taken a legislative stance that we are a state of local control, and therefore, schools will make individual decisions on how to operate as opposed to the state mandates that were issued in the past. Each school examines their physical environment, resources, both human and fiscal, as well as their unique needs in operating during a pandemic. As a result, communities are seeing a variety of approaches to how our schools are operating. Locally, our schools were able to remain open the majority of time last school year and are committed to providing face-to-face instruction for the 2021-22 school year. With that said, much has changed over the course of the last year. One of the updates for this year is the quarantine policy. When looking at the Ohio Department of Health guidance for quarantine and exposure, the first question is to determine if the individual was vaccinated. When the response is yes and the individual is non-symptomatic, they are permitted to remain in school and participate in extracurricular activities. Keep in mind that the vaccine is only approved for those 12 and up. With a pre-K to 12 school system, this leaves approximately 60% of our school-age children who are not afforded the option for a vaccine. For the unvaccinated individuals, the option then becomes, did the exposed individual consistently wear a mask? If yes, and they are non-symptomatic, they can remain in the classroom and participate in extracurricular activities. For individuals not vaccinated nor wearing a mask, exposure leads to quarantine. For this reason, we are seeing more and more local schools issuing mask mandates. Last week, around 30% of the schools in Ohio had some mask policy in place, with the intent of keeping non-symptomatic staff and students in school, as well as being able to participate in school-related activities. A week later, the districts requiring mask mandates in Ohio has grown to nearly 40% in the state. It is important to remember that when our schools did go remote last year, the driving factor was the sheer volume of quarantines and the inability to adequately staff the school. As the virus continues to evolve, so will our school practices. As you have heard today, vaccines are our most effective tool to reducing the risk of COVID. However, no one strategy is 100% successful. This is the reason folks are encouraged to diversify retirement portfolios and the old adage, don't place all of your eggs in one basket. Our schools continue to implement multiple mitigation strategies such as air purification systems, social distancing, touchless surfaces, prepackaged lunch or prepared served meals as opposed to self-service options, the frequent disinfectant of high-touch surfaces, hand washing stations, and desk barriers, to name a few. Students are placed in cohorts, and seating charts are utilized to help contact tracing should there be a positive exposure. Please understand that some of the procedures and practices we are utilizing today may change throughout the course of the year. As we are speaking today, there is currently a 10-district cohort in Warren County, Cincinnati area, taking part in a pilot study to explore the use of rapid tests along with mask wearing to permit students exposed to coronavirus to remain in the schools. Our schools will continue to look for best practices aimed at safe continuity of our education system. We have scheduled weekly communications with the Jefferson Health Department to discuss mitigation efforts. The Health Department has been very supportive of our district needs, and I would like to personally thank Andrew and his staff, as well as our school leaders, boards of education, employees, families, and children for their efforts to protect the health of everyone involved. Be assured that each decision made takes place with the single goal of keeping our schools safely open for everyone. I'd also like to give a special thank you for WTOV 9 for providing this opportunity to reach out to our audience. Thank you.